Hi, I'm Jana Gordon-Elliott from the Department of Psychiatry. Now we're going to speak about the mindful time out. So just like the timeout that's done before procedures, this is the timeout that we can do at any point during our day to integrate just a little bit of mindfulness. So some days we don't even feel like we have a minute to spare. During a crisis, this is common, but it's also essential during a crisis that we find moments of mental and physical recovery so we can stay in the game for the long haul. Fortunately, you don't have to meditate to get some of the benefits of mindfulness. Even a second of being mindful gives you a little pause and also puts a brake on the sympathetic nervous system, that's the fight or flight system, so that you can be in it for the long game. So what are mindful timeouts? What you can do is you can pick a few moments of the day with some importance. So maybe that's when you enter the hospital for the first time in the day. Maybe it's when you gown up for the first time in the day. Maybe it's when you gather your team for rounds. Maybe it's when you log onto the infonet or onto Zoom for your daily update from leadership. When one of these moments arises, just for a second, take a breath. Be aware that you're taking a breath. To mark that moment, maybe do something physical, like look up or just close your eyes for even just a fraction of a second, to make sure that your body and your mind has taken into account that you have taken that breath, that you have marked this moment, this space. Maybe even have a word that you will say in your head, like pause, space, stop, here, breathe. Then move on. Moment over. If you want, you could even try doing this with a teammate. Being in sync with another person has a calming effect on our nervous system. So give it a try and see what you think.